Nobody warned you. Nobody sat you down and explained what was coming. And when it arrived, you thought something was seriously wrong with you. Your sleep disappeared overnight. Your mood shifted in ways that frightened you. Your body changed in ways that made absolutely no sense. You gained weight without changing anything about how you ate. Your heart raced for no reason at all. You forgot words you have used your entire life. You sweated through your sheets at 3 in the morning and lay there in the dark wondering what on earth was happening to you. And through all of it, you kept asking yourself the same question: is this just aging? Is something wrong with me? Am I losing my mind? No, there is nothing wrong with you. What you experienced, what you may still be experiencing right now, has a name. It is called perimenopause. And today I am going to walk you through 10 signs of perimenopause, clearly, honestly, and with the respect that every woman navigating this transition deserves. Before we get into the signs, let me make sure we are all on the same page about what perimenopause actually is, because there is a lot of confusion about this word even among women who have heard it before. Perimenopause is not menopause. Menopause is a single point in time, the moment when a woman has gone 12 consecutive months without a menstrual period. Perimenopause is the transition that leads up to that moment, and it can begin anywhere from 4 to 10 years before your final period. It typically starts in the mid to late 40s, though it can begin earlier, and it is characterized by estrogen levels that do not simply decline gradually in a straight line. They spike dramatically, drop suddenly, spike again, drop again, creating a hormonal environment of profound unpredictability that affects virtually every system in your body that has estrogen receptors. And estrogen receptors are found in the brain, the heart, the bones, the skin, the bladder, the gut, the joints, and the blood vessels. This is why perimenopause produces such a bewildering variety of symptoms that seem completely unrelated to each other. This is why so many women spend months or even years seeing different doctors for different symptoms without anyone connecting the dots. So let us connect those dots right now, one sign at a time. The first sign is irregular periods, and this is almost always the earliest and most obvious signal that perimenopause has begun. If you have had a regular, predictable menstrual cycle for your entire adult life, and you suddenly notice changes in the timing, the length, or the flow of your periods, perimenopause should be one of the first things you consider. The changes can go in either direction. Some women find their cycles getting shorter, arriving every 21 or 22 days instead of 28. Others find their cycles stretching longer, skipping months between periods entirely. Some women experience dramatic changes in flow, periods that are suddenly so heavy they are flooding through protection in ways that feel alarming and completely unlike anything before. Others find their periods becoming lighter and shorter over time. Spotting between periods is also common. The key characteristic is unpredictability. A cycle you could have set your calendar by for 30 years suddenly becomes impossible to predict from one month to the next. This happens because the ovaries are producing estrogen in increasingly erratic patterns. Ovulation becomes irregular. The hormonal signals that govern cycle timing are fluctuating instead of following the established rhythm. It is important to know that not all period changes are perimenopause. Heavy or irregular bleeding can also be caused by fibroids, polyps, thyroid disorders, or in rare cases, something more serious. Any significantly abnormal bleeding always warrants a conversation with your doctor. The second sign is hot flashes and night sweats, and these are the symptoms most commonly associated with menopause in popular culture. Though many women are genuinely surprised to learn they can begin years before their final period. A hot flash is a sudden, intense sensation of heat that begins in the chest and spreads upward to the neck and face, often accompanied by visible flushing, sweating, and sometimes a rapid heart rate. They last anywhere from 1 to 5 minutes and can occur multiple times throughout the day. Night sweats are the nighttime version, episodes of intense sweating during sleep that can be severe enough to wake you and leave you needing to change your pajamas or your bedding entirely. Hot flashes occur because declining estrogen affects the hypothalamus, the part of the brain responsible for regulating body temperature. The hypothalamus becomes more sensitive to even minor changes in core body temperature and responds by triggering heat dissipating mechanisms, sweating, flushing, in response to fluctuations it would previously have managed without any noticeable reaction. Approximately 75% of women experience hot flashes during the menopausal transition, and they can persist for an average of 7 years, in some women significantly longer than that. Caffeine, alcohol, spicy foods, warm environments, stress, and tight clothing are all known triggers that can intensify hot flashes. Being aware of your personal triggers and reducing them where possible can make a meaningful difference for many women. The third sign is sleep disruption, and this is one that has enormous consequences for everything else in your life, which is why I want you to take it seriously. Sleep changes during perimenopause are nearly universal, and they happen through multiple mechanisms at once. Night sweats wake you from sleep repeatedly, preventing the deep restorative sleep stages your body needs to repair and recover. Declining estrogen and progesterone, both of which have sleep-promoting effects on the brain, reduce the quality of your sleep independent of any hot flashes. The anxiety and mood changes that come with perimenopause create a state of mental hyperarousal that makes falling asleep difficult and promotes waking in the early hours of the morning. The result for many perimenopausal women is a pattern of lying awake for hours, waking multiple times, and reaching morning feeling profoundly exhausted despite having spent adequate time in bed. And the consequences compound: impaired memory, elevated blood pressure, worsened blood sugar, increased cardiovascular risk, worse mood, and dramatically reduced quality of life. If your sleep is significantly disrupted, this deserves to be at the top of your list of things to address. The fourth sign is mood changes, and I want to address this one with particular care because it is the sign that causes women the most confusion and the most distress. During perimenopause, many women experience significant shifts in their emotional landscape that feel qualitatively different from anything they have experienced before. Irritability that is disproportionate to whatever triggered it, anxiety that seems to come from nowhere, a shorter fuse with people they love, sadness or low mood without any obvious external cause, emotional reactivity, feeling things more intensely than before, recovering from upset more slowly. Some women experience their first significant depressive episode during perimenopause. The rates of clinical depression nearly double during this transition compared to the premenopausal years. These mood changes happen because estrogen has profound effects on the neurotransmitter systems that regulate how we feel, particularly serotonin and dopamine. When estrogen fluctuates wildly, these mood-regulating chemicals fluctuate with it. Sleep deprivation from night sweats and insomnia compounds everything. Understanding that these mood changes have a real neurobiological basis, that they are not weakness, not overreaction, not a failure of character, is genuinely important. You are not losing your mind. Your brain chemistry is responding to a real hormonal shift, and that deserves real treatment. The fifth sign is brain fog and cognitive changes. And this is the one that frightens women most. Because when you cannot find words mid-sentence, when you walk into a room and cannot remember why you went there, when you read the same paragraph 4 times and retain nothing, your mind goes immediately to the worst possible explanation. Approximately 60% of perimenopausal women report these cognitive symptoms. And I want to say this clearly: the research on perimenopause and cognition shows that these changes are real, but they are also largely temporary. The brain fog of perimenopause does not predict dementia. It improves for most women once hormone levels stabilize after menopause. The mechanism involves estrogen's effects on the hippocampus and prefrontal cortex, the brain regions most involved in memory and clear thinking. The fluctuating estrogen of perimenopause temporarily disrupts these regions. Sleep deprivation makes it dramatically worse, which is why addressing sleep is so critical during this transition. The sixth sign is weight gain. specifically the frustrating, stubborn accumulation of fat around the abdomen that appears during perimenopause, regardless of how carefully women are eating and exercising. Many women gain 5 to 15 pounds during this transition and find that fat that used to sit on the hips and thighs now concentrates around the middle. This shift happens for several interconnected reasons. Declining estrogen changes fat storage patterns toward the abdomen. Muscle mass declines, reducing the number of calories the body burns at rest. Insulin sensitivity decreases, meaning carbohydrates that were metabolized efficiently at 35 now drive fat storage more readily at 50. And sleep deprivation drives hunger hormones and promotes fat storage on top of everything else. This is not a willpower failure. This is a biological shift in metabolism and fat distribution. Resistance training, which rebuilds and preserves muscle mass, is the single most effective exercise response. High protein intake supports muscle preservation. Reducing refined carbohydrates addresses the worsened insulin sensitivity. And prioritizing sleep matters more than most women realize. The seventh sign is joint pain, which surprises many women because they do not typically connect aching joints with their hormones. But estrogen receptors exist throughout the joints, tendons, and connective tissue of the body. As estrogen fluctuates and declines, many women notice new or worsening aching in their hands, wrists, knees, hips, and shoulders, sometimes in multiple joints simultaneously. Stiffness in the morning that gradually improves through the day is a particularly common pattern. Anti-inflammatory eating, more omega-3 rich fish, olive oil, vegetables, fewer processed foods can help meaningfully. Strength training that builds muscle around the major joints reduces the mechanical load on joint surfaces. Staying well hydrated supports the fluid that lubricates joint movement. The eighth sign is urinary changes, and this is one that is almost never discussed in popular coverage of perimenopause despite affecting a very large proportion of women and significantly impacting daily life. Increased urgency, running to the bathroom more frequently than before. Recurrent urinary tract infections that were never a problem previously. This happens because estrogen maintains the health and thickness of the tissues lining the bladder and urethra. As estrogen declines, these tissues become thinner, drier, and less resilient. The bladder becomes more sensitive, creating urgency and frequency. The protective barrier against bacteria weakens, explaining the increased infections. Vaginal dryness and discomfort are part of the same process. Local estrogen therapy applied directly to the vaginal tissues is safe for almost all women, including those who cannot use systemic hormone therapy, and it is highly effective for these symptoms. The ninth sign is heart palpitations, a symptom that sends many perimenopausal women to the emergency room convinced they are having a cardiac event. A racing heartbeat, a fluttering sensation in the chest, a sudden awareness of your heart beating rapidly or irregularly, and then it stops as suddenly as it started. Perimenopausal palpitations are caused by estrogen's effects on the autonomic nervous system and the heart's electrical conduction system. As estrogen fluctuates dramatically, it affects heart rate and rhythm in ways that are usually benign but genuinely terrifying in the moment. I want to be absolutely clear. Heart palpitations should always be medically evaluated when they first occur to rule out genuine cardiac arrhythmias. An electrocardiogram is appropriate. Once cardiac causes have been ruled out, reducing caffeine, managing stress, and ensuring adequate magnesium intake can reduce the frequency of episodes significantly. The 10th sign is skin and hair changes. Dry skin that seems to have developed suddenly, hair that is thinning or falling more than usual, and in some women, the appearance of new facial hair where it was not present before. Estrogen maintains the collagen content and moisture retention of skin and supports the normal hair growth cycle. As estrogen declines, collagen production decreases. Skin becomes thinner, drier, and less elastic. Hair follicles that were supported by estrogen shift toward the resting phase of the growth cycle, producing the shedding and thinning that many women find deeply distressing. Increased moisturization, sun protection, and ingredients like retinoids that support collagen production help the skin. For hair, adequate protein intake matters, and it is worth checking iron and ferritin levels. Iron deficiency is a frequently missed cause of hair loss in perimenopausal women that is entirely treatable once identified. So those are the 10 signs: irregular periods, hot flashes and night sweats, sleep disruption, mood changes and anxiety, brain fog and cognitive changes, abdominal weight gain, joint pain, urinary changes, heart palpitations, and skin and hair changes, all of them connected, all of them rooted in the same hormonal transition that millions of women are navigating right now without adequate information or support. Here is what I want you to take away from everything you have just heard. You do not have to simply endure this. Hormone therapy, when appropriately prescribed to the right candidates, remains the most effective treatment available for hot flashes, sleep disruption, mood changes, and many of the other symptoms we discussed today. The fear surrounding hormone therapy that was generated by a single study in the early 2000s has been substantially revised by more than 2 decades of subsequent research. Non-hormonal options also exist for women who cannot or choose not to use hormones, and lifestyle changes, resistance training, protein intake, sleep prioritization, anti-inflammatory eating, make a real and measurable difference across virtually every symptom category. None of it starts, though, until you understand what is happening in your body. Now you do. Talk to your doctor, ask the questions, advocate for yourself. You have been navigating this without enough information for long enough. That changes today.